this stuff work, and that's just the way it is. And so I think some of these things, when you think about, okay, what is the road here that we're going to be traveling, how sustainable is some of the stuff that some people are advocating or some people have done. I mean, the fact of the matter is, we can succeed at social distancing up until the point where the public decides they've had enough of it. And so I think we want to do it in a way that will be effective at addressing the virus's spread, but is also not going in a direction where people are then going to channel their activity in other ways, which may be just as problematic. And so I think that's the better approach to do it. And again, we just got this guidance. I mean, remember yesterday CDC said 50 people for gatherings. Then less than 24 hours or 24 hours later, now it's the 10. So we're just trying to make sure that we're taking what they said. We wanted to do some other guidance, but if we put that out, we would have said the 50. And so now it's the 10. So we've got to make sure that we're synthesizing this and doing it in a way that makes the most sense.
An update on how everything's going with the Broward mobile testing facility. I know that Colorado had problems getting people that actually needed to be tested compared to those that were just worried.
Well, so they're working on it, but we are going to follow similar to what the federal government's doing, in the sense that this mobile testing site is going to be prioritizing healthcare workers and folks that are 65 and older with symptoms. That is going to be the priority. How it expands from there, and it might, we'll see. But I think this will be an easy way for those folks to do it. I think when states have had problems is because, it's just kind of people are just showing up who don't have symptoms, and that's not really the target. So we want to have easy access to this, but really focus it on those folks who really need it. Yes, ma'am.
Schools are out for 2 weeks. Is that enough time for them to be out? And on the other hand, what is being done to help those parents with childcare?
No, it's a good question. It's the fact of the matter is you have a lot of parents who are, they work when their kids are at school. So one of the things we did with the state employees is we let the employees donate leave to each other, so that if someone needs to stay home, they can do it. I think that what the federal government's doing with the relief package should have that in mind, that you're going to have some folks that are going to be sick, and then we don't want them going into work. But then you're also going to have folks who, if you're telling the kids to be home, sometimes the parent needs to be there. I mean, a lot of times people go to the grandparents. Well, if we're in a situation where we're trying to stop the spread of this, where young people may carry it but not exhibit any symptoms, well, then that becomes problematic as well. So that's why, with the schools, we did it very gingerly on that, and it does create other issues when you're dealing with that. And so they're going to have the 2 weeks. It'll constantly be reevaluated, and then we'll go from there. But it's and then for the food, I think the food is an issue. That's where some kids get a lot of nutrition. Fortunately, we've had a lot of people step up with that. We got a waiver from the federal government for agriculture consumer service to be able to use that. So I think that's a good thing. But it's definitely any of these things create other issues that you then have to contend with. Yes, sir.
Governor, is there anything that's being done right now to help with temporary unemployment for perhaps restaurant workers or anyone else in those industries?
So I think we're going to see, what they're doing out of Congress. My view on what they did so far is that I think it was good that you're having the testing and all that and the money for that. But in terms of the economic portion, I thought it was inadequate. I don't think it's going to be quick enough. I think there's going to be too much bureaucracy about how you use this paid leave tax credit. And so I know a lot of senators have already said we may need to do this a little bit better. And I would recommend that they take a look at that, because I think what you need is immediate relief for people. And it's not just, some of the folks won't necessarily be completely unemployed. Maybe they'll just be furloughed for 2 weeks or 4 weeks. Well, for folks who are low income, that may be very difficult for them. Other folks will be able to do it because they have money stacked away, but a lot of workers do not. So I would say get it out very quickly. Don't run it through crazy bureaucracies. And then that will really be, I think, the lifeline that people need. If you look, obviously the economy has taken a hit because of what's happening, but there wasn't any underlying problems with the economy. It was just, this is an external force that's coming in and changing things. So I think if we get on the other side of this curve, and people can start going back on their getting back to business, I think that those people can be hired in the hopefully relatively near future. But man, if they can't pay rent for, if they have 6 weeks or they can't pay rent, can't afford basics, it's going to be a problem. So I think that's the number one way to do it, and I would want to see what the federal government would do. But to do a relief that's going to take 4 or 5 months for people to even make sense of it, I think that's a problem. Yep.
Yeah, Governor, could you confirm if there's been a confirmed case in Escambia County or not?
Can we confirm Escambia? Do you know?
We'll have to look at the records for that.
We'll let you know.
Yeah, Johnson.
Thousands
Thousands
of
of
cruise
passengers were allowed to disembark at Port Miami yesterday without any kind of medical screening. How did that happen?
You'll have to ask the port on that. I mean, I think that CDC is screening the folks or involved with. If there's health issues on the cruise, then we at the state would be alerted. We were not alerted. I guess, was there any did anyone have flu-like symptoms on that most recent ship?
Yeah, nobody was known to have COVID-19 actually.
Yeah. So.
Governor, with this new dashboard, it's got a lot of interesting new information, but it also seems to be missing some information that we were getting on the regular before, where we had the ages of the people.
I think you'll still have that. I mean, you'll still have the rundown. You'll still have the rundown. I mean, you're going to still put out the same rundowns you did, correct? Yeah, on a daily basis. So you'll have that, but then it'll also, if someone wants to get a big picture look and see, okay, what's going on in Florida, you're going to be able to see, there's Broward has the most cases. You'll be able to see where it's popping up in other communities, and so we think it's an additional tool, not in lieu of that, but in addition to that. Thank you.
What about the First Lady? How are you keeping her safe right now?
She's, we had one child in the midst of an election for governor 2018 in March. Now we're 2020 in the midst of a pandemic. So this one's a little bit more nerve-wracking than that one, I think, for her. But she's doing very good. And fortunately, she doesn't have any health issues. But it doesn't seem that this is something that affects young kids or pregnant women. Now, there's not enough cases to know for sure. But she's doing a lot to keep safe. So thank you, though, for asking.
Mics. Good night from the SEOC in Tallahassee, Florida. Good night captions. Good night satellite.